Welcome, everyone. This is the fifth session of Nursing on the Front Lines of the Climate Crisis, Education for Action. This session is on mental health. Sorry, I'm having a little bit of trouble with my computer. Attendance confirmation for all participants and continuing education credit for US-based participants will be provided for both live and asynchronous participation. Individuals who attend the session live will receive a passcode to bypass the video on the learning site where you can receive your continuing education credit. Continuing education credits are given by the Alliance of Nurses for Healthy Environments on the new learning site. If you go onto the site, please note that it is a brand new site and we are having some hiccups. And so if you do not receive a verification email for your email address and your account, please allow a couple days. I am going into the system multiple times a day to confirm those accounts. The session will be 60 minutes long. We will have two presenters and hopefully some time for a short question and answer session at the end. Please add your questions into the Q&A and not into the chat. Session video recordings, slide decks, and resources will be made available on the course website. And now I would like to introduce our two speakers. Are you still seeing the presentation?
We see Mitzie's bio.
Are you able to share the presentation so I have my notes available?
Yes, yeah, you can stop share. Also, your screen is frozen, Hannah, your image.
Let me,
if it's just me.
I'm gonna go off video. Sometimes that makes it easier for my screen to work.
Sure, okay, 1 second. Let me
Thank you, everyone, for your patience. Okay, Dr. Mitzie Meyers has been a dedicated professional to the health of people and the environment throughout her nursing career in neonatal and pediatric practice, and as a nurse educator. She currently serves as a full-time faculty at the University of Northern Colorado School of Nursing and is a clinical advisor for Tender Care Pediatrics in Fort Collins. Mitzie has served on the Planetary Health Task Force for the American Holistic Nurses Association for the past 3 years. She has been a nursing core team member of the Global Consortium on Climate and Health Education for the past 1.5 years, helping to develop educational resources for nurses as part of the Nursing Climate Resources for Health Education team. Mitzie has made local and national presentations on planetary health. She has published several nursing articles on the topic and is currently co-authoring a chapter on planetary and environmental health and well-being in a nursing textbook. Mitzie is certified as a nurse educator and in advanced holistic nursing. She has designed academic courses in planetary health and integrated concepts into existing nursing courses. While living in both her hometown of New Orleans and now in Colorado, Mitzie enjoys time in nature and working towards conserving our ecosystems. Our co-speaker is nurse Josephine Williams, clinical instructor at the University of the West Indies Five Islands campus in Antigua and Barbuda. Josephine Williams is a registered nurse with 17 years of experience, a certified emergency trained nurse, and holds a master's degree in education, specializing in health promotion. She works as a clinical instructor at the University of the West Indies, an associate member of Earth Medic and Earth Nurse. Additionally, she leads the Earth Medic, Earth Nurse Antigua and Barbuda chapter. Please welcome our first speaker, Dr. Mitzie Meyers.
Thank you, Hannah, for that introduction, and greetings to everyone from around the world who's joining us today. I'm honored to be here to speak with you about mental health as it relates to the climate crisis. And I come to you today speaking as not only a fellow nurse, but as a mental health advocate, someone who is passionate about the environment, and also someone with the lived experience of Hurricane Katrina. So we talked about that in our last session, and now I'm living in Colorado, so I've been able to experience climate in terms of floods, hurricanes, wildfires, and drought. Next slide, please. These are our session learning objectives. Today we'll be exploring factors that influence psychological impacts of the climate crisis, as well as barriers, consequences, some mental health terms, and we'll talk about vulnerable populations and also some health strategies. Next slide. My biggest hope for your takeaway today from our time together is just an extraordinary sensitivity and understanding of the significance to mental health that we have an opportunity to intervene with as healthcare practitioners. So within a holistic paradigm, mental health is in conjunction with the whole, and the World Health Organization defines mental health as a state of well-being that enables people to cope with the stressors of life, realize their abilities, learn and work well, and contribute to their community. And global threats, such as the growing climate crisis, threaten mental well-being for individuals, families, and communities. As global warming progresses, so will the increased incidence of mental illness, and there will be a greater mental health burden on the general population. Next slide. I wanted to present mental health statistics pre-pandemic so we could see a baseline of where we were before the COVID-19 pandemic happened worldwide. So in 2019, 970 million people worldwide were living with a mental disorder. Anxiety and depression were the most prevalent. And in that year, 726,000 people we lost who took their own lives. And we know that once the COVID pandemic came, that increased mental health illness and anxiety and depression from all of the factors that went along with that pandemic. And that gives us an idea of where we are now as we begin to speak about a climate crisis, to the mental health sensitivity of those around the world. So the World Health Organization is urging countries to include mental health support in their climate crisis response. Next slide. So with that in mind, I'd like us just to pause for just a moment and gaze at this beautiful image of a forest with all of its greenery, grasses, ferns, mosses, the soil, the rock, the sunlight, the trees. And so for some of us, just gazing at this picture is calming and relaxing, or being in a space like this would be very calming and make us feel secure and like everything's going to be okay. Mother Earth has a way of doing that for us. And so I show you this slide to highlight our interconnection with nature, which is really a central part of the framework when we talk about planetary health and climate change. Just appreciating what Mother Earth gives us and what we can do as stewards to Mother Earth. So just keep that interconnection in mind as we go forward. Next slide. So nature can make us have positive feelings, but there are some other types of feelings associated with climate change. We can feel sadness due to the loss that we see around us to biodiversity and to degradation of our land, water, and soil. We might feel a sense of hopelessness or powerlessness to do something about it. We can feel anger or guilt even for what we have not done or still have not been able to do. We might feel fear or insecurity about the unknown or maybe the loss of our home. There might also be just an overriding sense of fatalism or doom and gloom. So it's important for us as healthcare practitioners to recognize that these are normal feelings associated with climate change and the crisis that is forthcoming for us. And just recognizing that in the aftermath of some of these extreme weather events, there is suffering. Next slide, please. So within a mental health framework, I wanted to discuss social and structural determinants of mental health. And on an individual level, we can consider psychological and biological factors as well as genetics to think about how individuals may cope or how they also might be dealing with any mental health feelings they have regarding climate. Also, our emotional skills, our ability to regulate our emotions, and our degree of emotional intelligence. Substance use may also be a factor. And in a broader sense, in terms of society, exposure to unfavorable social, economic, geopolitical, and environmental circumstances. So these are those social determinants that frame our quality of life, of how we live our life every day in the communities where we live. And this speaks to the social justice piece with climate change, that those who contribute the least are being impacted the most. So the level of distress is often associated with how close we are to where these climate events are happening. Next slide. I'd like to introduce you to some climate and mental health terms that may be new to you. Eco-anxiety is described as a psychological response to climate change. It's an emotion of fear or worry related to the known and the unknown regarding our changing planet. Eco-grief is when people notice or anticipate the loss of species, ecosystems, or landscapes due to environmental change. And solastalgia is pain or distress caused by a lack of solace, a sense of isolation from one's home, or detachment in response to losing an important place. And I can speak from my own lived experience going through Hurricane Katrina that I felt all of these emotions. I didn't know what they were at the time. I don't know if these terms existed, but I definitely felt anxiety in the few days before that storm came because there was an ominous feeling around everyone. It didn't feel like other hurricanes that we had experienced. And the grief I felt as I watched my city go underwater, and then the sense of solastalgia I felt afterward, being a Katrina refugee, being a migrant, not being able to go back home, and knowing that my home would not be the same. And as we've just experienced in the United States, Hurricane Helene, again, these emotions came right back to me, seeing what people are experiencing there in Florida. Next slide. These are the effects of climate change on mental health, and there are direct and indirect effects. The direct effects have to do with that direct exposure to those extreme weather events, whether it be heat, flood, drought, hurricane. And the indirect effects are the consequences of that. So that migration, that's forced displacement, hunger, and food and water scarcity, and loss of housing. And in between those effects are intersectional effects. And these have to do with that social justice piece. So just the inequality or exclusion or isolation or discrimination that some groups may find. And when we put all of those effects together, it leads to adverse mental health consequences. And we may see this in affective disorders, anxiety, PTSD, psychosis, substance use, and also suicide. Next slide. Evidence shows us that periods of intense heat have an association with aggression and psychiatric emergencies. And why? Because it's hot. It's really hot. And I've experienced this and seen the behavior change in people. Air pollution can lead to decreased mood and social relations because we're stuck inside and we're not able to go outside, get fresh air, feel the sun, be around other people. And so sometimes it can affect our mood. Periods of drought can cause feelings of emotional distress and depression. Instead of seeing that beautiful scene that I showed with all the greenery, it may look more brown or like things are not quite alive and thriving in nature. And then any natural disaster can lead to trauma, substance use, decreased sleep, or an increase in risky behaviors. Next slide. So in past sessions, we have highlighted vulnerable populations, and the same is true for mental health. The mental health impacts of climate change are inequitably distributed, and these are some of the groups that are vulnerable to mental health, and there are a lot of them. Low-income groups, our older adults, children, adolescents, and young adults. And as a pediatric nurse, I can speak to this because children are going through developmentally sensitive periods and are especially vulnerable. Pregnant women, Indigenous peoples who hold our land sacred, those who experience any inequity due to race, gender, education, or finances, persons with disabilities or chronic medical conditions, pre-existing mental illness, occupational groups such as outdoor workers, immigrants, migrants, the unhoused, and last, those without access to mental health care. And we know that globally, access to mental health care is limited and is a problem worldwide. Next slide. Let's talk about our future generations, because our youth are the people that may feel a sense of betrayal or a sense of moral injury regarding climate change, and present and past generations that maybe have not addressed this like we needed to. This group will be chronologically more exposed to the damage caused from climate change. And we know that in our youth, there is already high rates of mental illness, depression, and anxiety. And so this graphic depicts some of the feelings that youth are expressing toward climate change. Things like their daily lives are being impacted, and they're considering whether or not to have children in the future. They think that humanity is doomed. Some may think that people have failed to care for the planet. They might feel extremely frightened or worried or insecure, and feel that things they value may be lost. Next slide. And in this vein, I'd like to highlight a study called the International Changing Worlds Study. This was a transdisciplinary approach or collaboration between these 4 countries within a planetary health framework that looked at mental health impacts of climate change in youth. And in the United States, the findings were that the majority of youth reported moderate to high climate distress, but low levels of eco-anxiety, and that climate change was affecting how they were planning their future. In the United Kingdom, there was worry over climate change exceeding other life concerns, but the overall agency or power to be able to do anything about it was low. In India, climate change was interfering with youth mental health, but that distress did not necessarily translate into engagement. And in the Caribbean, mental health concerns were common among the youth regarding climate change, but they felt that they had competing more priority stressors. So there is some commonality among these countries and regions of the world, and there's also some variance in terms of how youth are feeling they can cope and deal with this. Next slide. This is just a graphic from Yale University that shows psychological distress around climate change by race, gender, and generation. And this is looking at adults in 2022. And so it shows that Hispanic culture and Generation Z has been vocal about climate and environment, that they are feeling the most psychological distress. And next slide. This slide just highlights, we can see sort of the same distribution there. And this question was asking about interest in talking with a counselor about global warming. And a recent report, survey from the Lancet that just came out, looked at youth in the United States age 8 to 25 years. And it showed that 85% reported being moderately concerned about climate change, with 38% reporting that it was impacting their mental health. So what all of these surveys and research show us and tell us over time is that we've seen this increase as far as people being concerned and it impacting mental health. Next slide. So the other end of the spectrum is people who deny climate change. And so from a psychological perspective, why do people deny climate change? There's several reasons why. It might be distancing, just this cognitive or emotional distancing from the issue as a way of, say, like a defense mechanism. Also, emotional reluctance to confront the frightening implications of this overwhelming issue. It may be political or religious resistance, or it could just be support for a high consuming lifestyle. And we know that with climate breakdown, we will need to change our lifestyle behaviors and also reduce consumption. Next slide. So in talking about barriers, as we move now into speaking about action that we can take, I wanted to just look at some of the psychological barriers, because this is where, as nurses, we can intervene. And so I chose this picture of the Great Barrier Reef, which is normally a colorful picture. But in this photo, the coral reefs have been bleached due to warming waters because of climate change. Next slide. This graphic depicts some of the psychological barriers toward action for climate change. And in this graphic, you can see it as the 4 Ds: distance, doom, dissonance, and denial. And so we see the individual in the middle, pretty far away from the climate message that we might all be putting out there. And that first barrier is the distance we talked about, and it might be cognitive, it may be more emotional. It can also be physical distance away from the problem. So if someone is not living directly in an area that's being impacted, and it's hard to imagine there's any place right now on the globe that's not being impacted, but it may be more of, well, that's happening over there to those people. It's not in my region. I don't need to worry about it. It might be just that overall sense of doom and gloom, that the sky is falling and it's just too much. Maybe a sense of dissonance where there's tension between two things that are out of harmony. Right now, our climate and our earth is out of harmony. But also in our world, we see a lot of polarization, with climate change being a political issue. And then the last one is just outright denial. So all of those 4 things can impact someone's identity and how they might relate to climate change and action that we can take. Next slide. So briefly, I just want to highlight a few of these barriers toward mitigation and adaptation. And what I'm speaking of here with mitigation is just reducing our risk for future damage and adapting to the climate breakdown that is currently happening. And the first category there is limited cognition. And this category is one I feel that as nurses and healthcare practitioners, we can have the opportunity for the most impact to make a difference. So there is this idea of ancient brain. And this is just referring to how our brains as humans have evolved over time to deal with immediate threats. So those threats right in front of us. And for some people, they do not see climate change as a threat that's right in front of us. It's maybe not there at all, or it's maybe out there in the future. And so one of the most beautiful books I've read about this is called The Good Ancestor. And in that book, they talk about a solution being long-term thinking, and that we will need to, even though our brains are wired differently, we will need to all develop a capability to have long-term solution thinking. Other barriers may be just not knowing, not being educated, feeling a numbness toward this issue in the environment. You know, we are still healing and recovering from the COVID-19 pandemic. And so for some, it just may be too much to take in right now, especially those of us that are healthcare providers. Maybe undervaluing what the risks are, or again, those feelings of powerlessness. Now, the ideologies, those are a little more difficult to penetrate because those are maybe areas where people kind of have their feet dug in. These would be things like worldviews, belief that Mother Nature as a secular deity, which doesn't need human intervention, this idea that technology alone can save us, and system justification, which is just justifying the status quo within a society for a particular lifestyle. Next slide. And lastly, other barriers are just comparisons, maybe to social norms or networks that we see on social media. And of course, cost and money is always seems to be in the center of issues. And so financial investments that people may have in certain industries are conflicting values around that. And then just overall discredence or mistrust of information that people are getting, or outright denial or misperceptions. Next slide. So given all that we have talked about just now, how do we work toward collective solutions for all of us joining internationally today as nurses, as healthcare providers? How do we work toward action for this issue related to mental health and climate? Next slide. And we will look at this through a planetary health ecological model framework. And as you can see in this model that we've presented in other sessions, it begins with the individual and then out from there toward family, community, nation, internationally, like we're joining today, and outward toward planetary health. Next slide. So I'd like to start individually with coping mechanisms and self-care strategies for climate-related stress. And what I'd like to say here is that as nurses, we probably already feel that we have so much to handle and so many time barriers. But what I'd like to reassure you with is that all we have to really do is expand what we're already doing. Just think about this in terms of these actions toward climate change as an expansiveness of our role and not necessarily this additional burden that we have to have. So the first thing I would say is just acceptance. You know, the lack of acceptance causes a lot of suffering unnecessarily. So just an acceptance of ourselves, where we are right here today, all the wonderful things we do as a nurse, acceptance of whatever feelings we might have around the issue of the climate crisis, acceptance of our moral responsibility to be a steward toward the earth, and acceptance of this problem of climate change without feeling that heavy burden, because we are not alone. We are all in this together. Another thing is just considering small ways to take individual action, either personally or professionally. And so I tell my nursing students, you know, what's your one thing? We all have that one thing that we can do, and you can start small because it does seem like it's this big, gigantic thing. When we start small and we find our one thing, that gives us a sense of meaning and purpose toward this cause. And we know that having a sense of meaning and purpose enhances our well-being. Having a plant-rich, healthy diet also has been shown to increase our well-being as well as helping the planet. being exposed to nature, just getting outdoors. Research has shown this is associated with improved mood and cognitive function. Staying in connection with others through social activism is also very helpful, and Talk Climate is a website for youth to do that. And then lastly here, just having self-compassion and making sure we're caring for ourselves as we do this work, because sometimes it can seem like it is heavy or make us sad. And when I start to feel that way, I just pull back a little and have some compassion for myself and for the earth, for all of us doing this work. Next slide, please. So talking more specific now to our role as nurses with some evidence-based strategies for individuals, families, and communities, we might first consider taking the Hippocratic Oath for the Anthropocene. So this is a pledge to take care of our earth, to do no more harm, to help with healing. Within this period of geological time now, that's called the Anthropocene, which just means that our earth is no longer able to sustain us at our current rate of consumption. We might also encourage our patients, as we're actively listening to them, if they're expressing feelings of distress over climate change, that we use our empathy skills to listen and educate. There are 3 tools out there that help us to assess psychological well-being as it relates to climate change. The CHANT tool was developed by the Washington State University. It's a quantitative tool for healthcare professionals to assess climate change feelings, as well as the SCARE tool, which is one we use in pediatrics for that population, as well as the environmental distress scale. How about prescribing nature? Evidence has shown us that contact with nature in small increments, 20 to 30-minute increments up to 2 hours a week, is very beneficial to our well-being. Next slide. And in our last session, Dr. Sattler talked about having an emergency plan and the importance of doing that before a disaster. And it stands to reason that if we are prepared ahead of time, we hopefully will feel less anxiety on the back end of these storms. If you have a patient on a tricyclic antidepressant or an antipsychotic, it's important to tell them and educate them that these drugs may disrupt heat regulation, and that's important if patients live in areas where there is intense heat. And lastly, I'd like to say that in terms of research, education, and health policy, these are broader roles that we all may have. Those were some practice strategies. Definitely need more research in terms of effect of climate change on mental health, support for our vulnerable groups, and just defining terms and constructs. For health policy, there's so many ways to get involved to advocate for mental health. With either nursing professional organizations, community organizations, or nonprofits. And one example that I can give is I became involved with mental health advocacy and health policy and legislation at the national level. And that's one of the ways that we got 988, which is a 3-digit number here in the United States that people can call specifically for a mental health crisis. Lastly, I would speak to education. I'm a nurse educator, and so some of the work I've done has been curricular in nature, integrating planetary health concepts into existing nursing courses, and also educating nurses, students, and people out in the community. Next slide. For those of you who are mental health practitioners, I did want to offer some specific mental health strategies that have been shown by research to be effective for distress with climate change. Mindfulness-based strategies, gratitude practices, reframing emotional pain into something that is more positive or that might lead us toward motivation, toward action. Challenging binary thinking patterns around that gloom and doom or black and white thinking. Cultivating sources of optimism and hope, which is what we're doing today. And lastly, just strengthen our resilience and our empowerment. Next slide. The American Psychiatric Association reminds us that protecting our climate isn't just good for our bodies, it's good for our minds too. So get out there in nature. And next slide. Lastly, I wanted to end with leaving you this quote about story, because one of the things I found that was helpful to help me cope during Hurricane Katrina was journaling. So I started journaling about 3 days before that storm came and continued to journal, even in the darkness, for about 3 months after. And it helped me feel grounded at that time and helped me normalize during a time that was completely abnormal. And when I look back on it now, what I can see is resilience from myself, from my family, from my community and my city. And so listening to our patients' stories and telling our own stories, I think, are very healing and can be transformative. So our quote is, stories can transform values into the motions needed to drive change, with anger helping to overcome apathy, hope conquering fear, solidarity alleviating isolation, and inspiration found in stories of successful change making, which yield the sense that individuals can make a difference. Next slides are just my references. I thank you all. I wish you peace and well-being. And now I turn it over to my colleague, Josephine.
Hi, Mitzie. Thank you so much for that presentation. And just even hear you talking about what you would have been through from Hurricane Katrina. And then when there's a hurricane coming, you're going to start having those feelings. And it is right that we need to accept these feelings, know what they are, and know how to deal with them. So my presentation is going to be focusing on the healthcare workers and other professionals and how do we deal with mental health that are related to climate change. That's the objective. We can go to the next slide. So Mitzi would have talked about nostalgia, and it's having that feeling of loss and that disconnect. So we know that we as healthcare professionals and other professionals, we sometimes experience this loss and disconnect. There is an estimated 3.3 to 3.6 billion people who are susceptible and are at a high risk of the impact of climate change. These changes are not experienced equitably across gender, income, class, ethnicity, age, and physical abilities. The low and middle income countries are most susceptible to climate surges and healthcare demand. The minority and the indigenous populations are challenged with climate-related health risks related to poverty, geography, and limited access to healthcare. They are also living in regions that are susceptible to extreme weather events. Example, the small island developing states in the Caribbean region. And I'm going to be looking at Grenada and St. Vincent and the Grenadines, who suffered tremendous loss after Hurricane Beryl. We would have had damages to crops and animals. This is not to say we are taking away from other countries who would have experienced loss, but because of my familiarity within the Caribbean, we're just going to be presenting stuff related to the Caribbean, but also acknowledging that this can happen to anyone across the region. Next slide. Climate change affects everyone physically and mentally, but healthcare professionals, including first responders and teachers, are often the most exposed to multiple changes. This is fueled by problems in the workplace. Our female workers are most affected, and that's because they are also parents. They're looking after the young, they're looking after their older relatives. Those who have already have existing mental problems are also at a higher risk, and this is for suicide. However, they preserve and they continue. Next slide. I'm going to share some stories with you. This is what one nurse had to say. As a healthcare professional, taking care of my mental health is my first priority. It has become even more important now to me post the COVID-19 pandemic. And we all know during COVID-19 pandemic, the stuff that we would have gone through. We would have gone through a lot of mental health issues, especially seeing our colleagues and seeing other patients coming in dying every day. This would have left a lasting impact on us all. And this one was from a first responder when he was working within a hurricane itself. I heard people crying for help and I was frightened about the death toll and for my daughter's safety. But I had no time to process everything because I had a job to do, to go and rescue those in need. Putting the needs of others first. I didn't have the option to stop working and focus on the safety of my family, potential loss of my house and belongings, or even my own care. So even for this, we see that we have to be putting others first, and sometimes we neglect our own mental health. Next slide. So consider this, looking at the psychological trauma, and then we can look at the medical trauma. What's the difference between them, and is there a greater between them? So is the psychological trauma greater than the medical trauma? Next slide. There are many factors that can influence the psychological impact of the climate crisis on the most vulnerable populations. Here is something to consider. Psychological trauma versus medical trauma. Both can cause mental health issues such as PTSD, which is post-traumatic stress disorder, anxiety, and depression. However, it also depends on the personal resilience of the person, their support system, and the nature of the trauma they would have faced. Climate-related mental health issues can be impacted by, it can have higher temperatures. This is associated with increased suicide, aggression, and substance use with an increased risk of mortality and morbidity for persons with existing mental health disorders. Increasing temperatures can lead to aggressive behaviors, including intimate partner violence and homicide. And again, we saw a lot of this during the COVID-19 pandemic. Next slide. Physical and repeated exposures to the elements of hurricane wind, rain, and storm surges can also impact individuals psychologically. Constant exposures and the demand of a high-stress working environment can increase the risk of mental health issues, leading to burnout, depression, anxiety, and post-traumatic stress disorder. We see these mostly in places like the ICU and also in the emergency department. Forced evacuation and migration, especially for children who are forced to leave their homes with loss of loved ones, pets, livelihood, and community stability. Individuals who experience flood reported higher levels of depression and anxiety, and increased use of alcohol and tobacco use associated with disasters and droughts, and recent personal adversity. So all these are factors that can affect you psychologically. Next slide. So for the case study, this is what one person had to report. Beryl left me with panic attacks, anxiety that just comes on with the feeling of being overwhelmed and with tears that I can't control. At times, I want to be by myself and I'm just sad. Hopelessness hits me on some days. It's like just watching the days go by and not achieving anything to get back to some sort of normalcy. I'm just spaced out at times and feel helpless. I'm not mentally prepared for work. I asked for a long leave and was denied. Now I am on sick leave and was advised to seek the help of a psychologist as I need help. My drinking has increased because of Beryl. Although I was displaced and I am with my family, I still miss being at home, having that solitude and just being able to say I am home. Lightning, thunder, and heavy rains have a totally new perspective now. They instantly took me back to the day of burial. And most times I go to sleep. Burial happened on my birthday, so birthdays now will be a constant reminder of what my family and I went through. Next slide. We are in the height of the hurricane season. My roof is still covered with tarp, and I am just paranoid about the best solution for a hurricane-proof roof. Just wish I didn't have to experience living through or experience this. I hardly get enough sleep as I don't feel sleepy. If I do fall asleep, once I wake up to use the bathroom, that is it for me. I can remember one time I could have sworn I heard galvanized moving. I was in and out of sleep for the balance of the night. It's hard, but I'm taking the necessary steps to cope. I guess it's just too much for me. I'm tired and I want to go back to what I call home. I feel bad that I can't be there for my kids at school, but I also want to give them my best, and I am unable to do so at this point. I am a person that always put people first. I am struggling with not being able to be there for them, but I have to get my PTSD under control before I can do that. To sum it all up, I hate burial. Next slide. So we're going to look at the unequal burden of climate-related mental illness, because we know we all don't experience it the same how at the same time or in the same spaces. Next slide. So we have global disparities. Global disparities look at the low and middle income countries and other vulnerable regions that face the brunt of climate change, like flooding and hurricanes. These countries lack the resources to adapt and cope with the effect of climate change. We also have the marginalized population, like the indigenous people, the economically disadvantaged, and communities of color. They are shown to be at a greater disadvantage and injustice to climate change. This can lead to mental health disparities, respond areas and communities that depend on a natural environment for their livelihood, such as agriculture, fishing, and tourism, at a greater risk. And you see these a lot within the Caribbean. Next slide. So what can be done? We can have policy responses by increasing access and funding towards mental health care, provide mental health resources and psychological first aid so employees feel respected, valued, and appreciated. Administrators and policymakers are crucial in creating and implementing health public policy that includes and prioritizes mentally impacting climate action and a safe working environment for all. Creating actionable plans and making mental health services a priority. The government is responsible for integrating mental health support into disaster risk reduction efforts. Next slide. So strategies and intervention, we're going to be looking at what we can do. So there's training for healthcare personnel, psychological first aid training, attending workshops, and empowering employees to develop resilience. We're going to expand more on these. Next slide. So we have work-based approaches through empowerment to build resilience through education, peer support, and intervention that meet the workers' needs. We can start by building our own personal health skills using coping strategies. Develop coping skills, exercises, stress management, recognizing your own emotions, and practice self-love and self-compassion. Don't be afraid to ask for help. Take frequent breaks from work and acknowledge that you are burnt out. This can help with recovery. Find a trusted friend or psychiatrist to talk to. Praying can also help. Create a healthy workspace through open communication. This provides ways for staff to express their concerns, give timely feedback, and address those concerns. Channels can include regular team meetings, suggestion boxes, and anonymous feedback system, promoting workplace cohesion, social support networks. We can also do gardening, outreach programs, and support groups. Employees, including healthcare professionals, should feel comfortable seeking help and not be stigmatized or afraid of job loss due to mental health issues. It is essential to ensure these services are available and promote wellness. Next slide. Train healthcare and other professionals to address mental health related illness through climate-informed mental health programs that provide psychological first aid, climate-related counseling, and therapy. Organize mental health awareness programs, workshops, and employee talks. Encourage stress management. Have a room dedicated to yoga or meditation. Recently, when I went to the University of Chicago School of Nursing, there was a meditation room which the staff can utilize. And also at the Georgetown Guyana Airport, there's a prayer room that is used for staff and visitors. We can also have equality on the job. Training healthcare personnel on mental health impact, psychological first aid training, providing equal opportunities for staff development and training to attend workshops and courses like this one that we're here right now. Next slide. In conclusion, we need to recognize that our healthcare workers, first responders, teachers, and other professionals are at risk of mental health issues related to climate change. Whatever your profession and whatever you work, as climate disasters increase, It's time to leave the stigma behind. Recognize that our minds are part of our bodies and prioritize mental health in all professionals. I'm gonna be showing a recording of what someone would have went through during Hurricane Beryl. Next slide. Can you play the recording? If you click on the recording, you should be able to see. Okay, unfortunately, the recording is not playing, but this will be available in the slide deck and everybody will be able to access it.
Thank you so much to both of our speakers today. That was very informational, and we have some great questions in the chat. And we will absolutely make sure that that recording and all the resources are available. Haley just put in the chat some information about upcoming webinars. We have time for a couple questions from Maggie Devane. Thank you for mentioning your own experience as a climate refugee after Katrina. I heard on NPR this morning that the average cost to Floridians evacuating from the recent hurricane was $500 per household. This certainly explains why low-income, older, and migrant populations aren't able to evacuate and therefore rely on social services. How can we improve the system to reduce stress and mental distress on those who don't have the means to evacuate or make improvements to feel safe at home?
Yes, thank you for that excellent question. I always like to speak about this because as I go around the nation and talk about evacuation and things from events, people will often say, well, why don't people just move? Why do they continue to live there? Why do people stay for the storms? And you're exactly right. It has everything to do with the financial resources to do so, having transportation, having somewhere to go, being able to get gasoline, being able to support yourself without an income for a while. And for some people, they may not have any place to go or relatives to go stay with. You may not know how long you're going to be displaced and be there. And what you saw in Hurricane Katrina was an just incredible amount of racial disparity and economic disparity with who was able to evacuate and who stayed. And of course, we know with that hurricane, the government was not prepared. We didn't see government response from the state or from federal for a while. There was a good lapse. And after a few days, media had left town. So people were, kind of on their own. So to answer your question about how do we address this, one of the ways I have tried to address it is speaking out for these populations and defending them in terms of people's thought process of, well, they should just be able to get up and leave. So I think it starts in the community of regions that can be impacted by storms like this, and certainly any type of storm where you would need to evacuate, that we are paying attention to these regions and areas where we have people who will need help. And I know there's often shelters in place but sometimes even those are not able to. One big problem is have people's pets. And sometimes people don't want to leave their pets. I know I don't. After Hurricane Katrina, they had to pass a law saying that you can't just leave your pet behind. And so,
Absolutely.
that's also an issue sometimes for people. So I think starting in the community, being aware of where these areas are and making sure that as storms approach, that we target these communities and see what assistance can be given. Also, just as much as we can prepare people to have these decisions in place, if we know that hurricane season runs from this time to this time, we don't have to wait until a few days before the storm to put these things in motion. I think the problem that's happening now, though, is they're intensifying so quickly from just a tropical storm to a Category 5 in a couple of days. There's not as much preparation time as we once had. Something else I would say is just as healthcare professionals, again, to advocate for our vulnerable populations. And, I can speak personally for myself that it's one of the reasons I felt the need that I got to the point where I was tired of riding out the storms. I didn't have a generator and I couldn't go, months and months in the August heat with no electricity. And being able to be with my family, go to work, do the things we normally do, it certainly impacts children because they don't like their routine messed up, and it gets messed up quite a bit. And lack of place to go and evacuate too. Everybody's out on the road trying to get somewhere. And so, just making sure that we speak out as nurses. One of the things, I'll just end with this, that I did with my students, once we were able to get back in school, which is a couple months after the storm, we went out into the community, and there was just so much limited access to healthcare. And so we just had a tent, went out, and we're there to help people with, health promotion types of things. So, that being getting disaster preparedness training, so you can also help with Red Cross and those kinds of things for those people who are there and are left behind.
Thank you so much. I think we have time for one more question. I'm going to combine a couple questions and ask Josephine, what is our role as nurses around mental health and climate, especially for community health nurses? And what public policies can be developed to safeguard the mental health of communities in response to climate change?
Yeah, that's a very good question. So first of all, our role as healthcare providers, as nurses, we have to know how climate change affects our mental health. If we do not have that information, we're not going to be able to go to the table to have the conversation with government agencies to make these policies. So it first starts with getting the information to know, how are we affected by climate change? So we are affected by climate change physically and mentally. And then once we prepare ourselves for that information, we can go forward now and put proposals and policies in place to protect ourselves and others.
Thank you. Well, I want to extend an absolute thank you to both of you for talking with us today about this incredibly important topic, especially in nursing, and how we can move forward. Lastly, I'd like to just invite everyone to next week's session. We will be talking about pollution, soil, water, and waste. Our speaker will be Dr. Ruth McDermott Levy, who is a professor and co-director of the Mid-Atlantic Center for Children's Health and the Environment, and at Villanova University. Please register for that event, and I'll hopefully see everyone next week. Thank you all so much, and have a great rest of your day and week.